Good day. Welcome to my poster presentation. My name is Stacy Winters, and I'm a student at the Psychiatric Mental Health Nurse Practitioner program at Eastern Kentucky University. Today I will speak to you about my proposed project and why it's important to healthcare and advanced practice nursing. Depression is currently the leading cause of disability amongst all adults worldwide, contributing to increases in healthcare costs related to substance abuse, falls, and comorbidities. While a variety of treatment options are effective, symptom management and adherence continue to be a problem. Depression decreases quality of life and also contributes to loss in wages, disability, and healthcare costs. Advanced practice nurses will be overburdened in the 21st century with the sheer number of patients that will come into the healthcare system, and nurse practitioners will be working as primary care providers. The purpose of this pilot study was to determine the effect of exercise on depression in older adults. The literature reviewed was specific to older adults. 4 non-randomized controlled trials were reviewed. The literature was consistent with the clinical recommendations of the APA, which is to recommend exercise along with cognitive behavioral therapy and antidepressants. In the literature, the participants performed resistance band exercises, aerobics, yoga, and Tai Chi. All of the exercises were effective for depression. Exercise is shown to have positive outcomes, especially in older adults. It increases self-esteem, ADLs, self-efficacy, decreases depression, and related chronic diseases. In my proposed study, I used a descriptive non-randomized time interval pre-test post-test design in a single one group. It will take place at Northampton Manor in Frederick, Maryland. 6 weeks prior to the study, a letter of inquiry will be sent to the clinical director at Northampton requesting a meeting and an opportunity to present evidence-based literature to the staff. A listening session will occur, and a meeting over refreshments will give the staff an opportunity to express any concerns about the study. If it is approved, a research team will meet with the clinical team to identify what residents would be appropriate for the study. A confidential letter will be sent specifically to those residents. 65 residents will be selected with the goal of getting 50 participants. This will allow for attrition. Residents who are of the age of 65 years diagnosed with depression and or taking antidepressants who have no medical contraindications will be able to participate in the resident band exercise study. Once medical clearance and informed consent are obtained, participants will complete the depression scale. It's a geriatric depression scale, which is a 15-item short form which assesses depression over the past week. It has internal consistency of 95%. Then the participants will participate in a 10-week resistant band class 3 times a week. Afterwards, depression will be reassessed. Also, the participants will complete the trans-theoretical model to assess for readiness for change. Pre-test scores and post-test scores will be measured and compared. A paired t-test will be used to compare their means. Also, the geriatric short patient experience questionnaire will be sent to the patients to assess patient satisfaction. The entire cost is estimated to be $500. The outcome of the geriatric depression scale will determine the success of the intervention. This data can help stakeholders discern whether the clinical practice change is appropriate for their environment and the population. The final evaluation will be based on whether the pilot met the original objections. Advanced practice nurses, as primary providers, can assist patients with depression in living a healthy lifestyle and produce lives through standard treatment and physical activity. Thank you so much for listening to my presentation.